Have you guys ever seen a dentist actually throw instruments out of anger at the dental practice? Hey, I'm Dr. Chris Griffin, and I'll tell you, there have been a bunch of times over the past 23 years that I have probably been mad enough to throw instruments. Knock on wood, so far I haven't done it yet, but it's been really close. So let me give you guys a little insight into why dentists might want to throw instruments, right? So you're there, you're ready for a particular instrument, you ask for that instrument, it's not on the setup for whatever reason, and say the assistant has to go get it or whatever, or they can't hand it to you quick enough when things are really in a tight spot, you know, you can get a little frustrated. And as you get frustrated, you know, as time goes on throughout the procedure, you might get more and more frustrated. And then next thing you know, you're getting ready to chunk your instruments, okay? So I'm gonna tell you guys the top 3 ways to throw instruments that I have heard about or seen and possibly seen in my career, okay? So number 1, I would say the most passive aggressive and least violent would be what I would call the golf flip. So if you've ever watched a pro golf tournament, you might have seen an instance where a caddy and a pro golfer had a discussion about what club they should hit, and if the caddy chose the wrong club after the shot, the golf pro might just flip the club on the ground instead of handing it gently back to the caddy, right? So in this instance, say your assistant now, after the procedure, you're very aggravated, is reaching out for the instruments, you've got your instrument in your hand, instead of just handing it back to them like you normally would, hey, everything's great, you want to just sort of give a little shout out, hey, it could have been a lot better. So they reach out for it, maybe you do a little golf flip, okay? That's one way to do it. Step 2. I'm gonna call this one the angry spouse because it reminds me so much of when I really tick off my wife, and instead of saying like why she's mad at me, she'll just go around the house slamming doors and slamming cabinets every chance she gets. That'll go on sometimes for half a day. I really never know what I did. But so in this case, I've seen dentists do this. They'll be angry about something, and when the procedure's over, say the assistant reaches for the instrument just like they should, like they normally would, instead of handing it gently back to the assistant, maybe the dentist does something like this. Just slams it down on the tray, the cassette, right? Just to make a point. Now that's bordering on causing a problem. You don't ever want to chunk your instruments in a way where the patient knows what's going on. Like you want to kind of keep it between you and the staff person and not say something directly in front of the patient. You know, that's a little unprofessional. The golf flip, definitely. You can get away with that all day long. The patient never knows what happens. The angry spouse, if you do it a little too loudly, the patient's going to catch on. So you want to keep that down a few decibel levels below what's going to catch the attention of the patient, okay? Now let's talk about the big one, the F5. The F5, we call this the F5 because an F5 means it's just like a tornado. It's something that could literally destroy your entire career and your life if it goes wrong, or it could decide to skip over your house and totally not hurt anything, right? So an F5 is when you have an instrument in your hand and you get angry, you get so angry, you can't even control yourself in front of the patient, you just chunk it against the wall or against the tray or against whatever. Now, first off, it's bad for your wall, you're gonna make marks on the wall, right? But also, this thing right here, normally you're chunking an instrument that has a sharp end on it. A lot of times the sharp end may have been in the patient's mouth, you've got blood, saliva. I literally had a staff person come up to me at a seminar about 10 years ago and they asked me, Dr. Griffin, could you talk to my dentist? He gets so upset. The other day he threw a sickle scaler, it bounced off the cassette and stuck in the back of my hand. Now that doctor is very lucky that that assistant didn't like go to the sheriff's office or like call his malpractice insurance carrier, right? So I'd actually never talked to that doctor. I was like staying out of that situation. It seemed pretty toxic, but yeah, I mean that's the kind of thing. You do not want to do the F5 toss with an instrument that has a sharp edge. If you can control your anger enough, if you're going to do the F5, you may not be able to, but if you take something like a mirror, you know, if you got a mirror, you chunk the mirror, if it bounces off, it's not sticking anybody, you know. I doubt they're plastic face now. They're not going to shatter everywhere. There's no sharp parts of it. I'm not suggesting you ever do an F5, but if you have to, a mirror's the way to go. So there you go. Now, hey, doctors, by the way, we're talking about you chunking instruments. Why are you chunking instruments, right? It kind of makes you look a little stupid. Because look, your assistants really are only as good as the training you've given them, Would it kill you to give them like a checklist to make sure everything's in the room before you get there? Would it kill you to do like some color coding every now and then to give them a good environment? No, it wouldn't. So honestly, don't chunk the instruments. It just looks bad on you. Give your staff, put them in the right environment to succeed, and let's get away from all this old-fashioned instrument chunking, okay? All right, we'll see you guys next time.